Hey guys, and welcome back to the channel. I'm Dr. Maddie, a doctor from the UK. Now, in today's video, we're going to be covering something a little bit different. We're going to be talking about the passing of a fitness influencer called Jo Lindner, or otherwise known as Joesthetics. Now, although he's got a lot of followers on social media and on YouTube, people probably know him best for his alien gains video, where he flexes his chest and you see this abnormal flickering in his musculature. And I have to admit, I did enjoy watching his videos. He seemed like a very relatable and kind guy. And so when I heard about him dying, it was a real shock. And although I don't have access to his medical records, some information has been released that he's actually died from an aneurysm. And I suspect for a lot of people who see Jo's physique and hear that he's died at age 30, they're likely going to think that it's related to excessive steroids, which is really a shame because an aneurysm is something very different. So in today's video, I'm going to be talking about what an aneurysm is, what are the risk factors for developing them, how do we treat them, and what are the prognosis. So firstly, what is an aneurysm? Well, an aneurysm is an abnormal bulge or dilation in a blood vessel, usually occurring in an artery. And it typically occurs when the wall of a blood vessel weakens and becomes thin. This causes it to balloon outwards and potentially rupture. Now, aneurysms can occur in any blood vessel around the body, but the most common types are those that occur in the cerebral vessels in the brain or the abdominal aorta. Now, starting with cerebral aneurysms, these are often asymptomatic and you might not know that you have one unless they rupture. When they do rupture, they cause bleeding in and around the brain. Now, this rupturing process can manifest in symptoms such as really severe headaches, neck pain, and loss of consciousness. Now, a ruptured cerebral aneurysm is a life-threatening condition, and if it's not treated surgically, people can quickly die. And from the details that I've heard about Jo's case, with how quickly he deteriorated and died, it makes me wonder whether he suffered from something like this. Now, the second kind of aneurysm we're going to be talking about is the abdominal aortic aneurysm, whereby you get an aneurysm in the main blood vessel that supplies blood to the lower limb and the pelvis. And much like the case with cerebral aneurysms, patients are often asymptomatic with these too, unless they rupture. And if they do rupture, once again, it leads to severe, massive internal bleeding. Now, the reason I think this one's less likely for Jo to have died from is because it typically occurs in people who are a bit older, who suffer from other risk factors such as high blood pressure, high cholesterol, and who are also smokers. Now, aneurysms can form for a variety of reasons, from genetic predispositions, where it runs in families, through to high blood pressure or atherosclerosis, where plaques form in the blood vessel wall, through to other things like trauma, infection, or other connective tissue disorders. And the fact that Jo is so young, only 30 years old when he's died from this, makes me wonder whether he had a genetic predisposition. Now, I do understand that Jo had been quite forthcoming about his anabolic steroid use in the past, and probably some of you are thinking, could this have been a contributing factor? And to be honest, it may well have played a factor, but my understanding was that his steroid use was overseen by a doctor. And what you'd expect a doctor to do is to perform regular checks of Jo's physical health, checking things like his blood pressure, his blood work, maybe an ECG, and even an echo scan of his heart. And if all those checks were being done regularly, you'd expect them to pick up the risk factors that are associated with aneurysm development. And it's for this reason why I suspect, for Jo at least, it's most likely a genetic predisposition, or unfortunately some really bad luck that's led to the development of his case. So there are some aneurysm types that can have either an inherited or genetic component. They are known as familial aneurysms because they tend to run in families and are caused by a specific genetic mutation or variation. And a well-known example of this is familial thoracic aortic aneurysm and dissection. And this is where individuals are predisposed to having aneurysms within the chest part of the aorta, or the blood vessel that carries blood from the heart round the body. Whereas another example of a genetic condition such as autosomal dominant polycystic kidney disease leads to a predilection of aneurysms, but in the brain. Now, it is important to note that although some aneurysms have a genetic component, not all of them are hereditary, meaning that you won't necessarily pass it on to your children. Unfortunately, many aneurysms are actually quite sporadic, occurring randomly with no clear family history. And if you have genuine concerns about the inheritability of aneurysms in your family, I would really recommend that you go and talk to your doctor, because they can organise some routine screening if it's necessary. So depending on what the aneurysm is and whether or not it's ruptured will really determine the treatment you'll end up getting. Clearly, if an aneurysm hasn't yet ruptured, then all treatment revolves around keeping things that way. And what that looks like for these patients is trying to reduce your modifiable risk factors, such as reducing your blood pressure, your cholesterol, and performing routine screening. Now, if that's for an aneurysm in the brain, it might be performing an MRI scan regularly, or if it's an abdominal aneurysm, then it may be about performing a jelly scan, like an ultrasound scan. Now, on the other hand, let's look at the other scenario where we've got a ruptured aneurysm. So clearly, any patient who's come through with a ruptured cerebral aneurysm is going to be really unwell. So you'd want to assess them for the extent of damage by doing a neurological examination. And shortly after this, you're going to want to perform an urgent CT scan to see the location of the burst aneurysm and also see the extent of bleeding. And other things to take into consideration when treating such patients, particularly if they come through and the bleeding is stabilised, is trying to control their blood pressure to prevent rebleeding from that ruptured aneurysm. Also, if there's evidence of swelling on the brain, such patients can come through with seizures, so making sure those are controlled is really important. So let's say you've stabilised your patient and they're now ready for urgent neurosurgery. This could either be one of two procedures. The first involves surgical clipping of the aneurysm, and this will involve a craniotomy where you remove part of the skull so you can directly visualise the aneurysm and place a clip at the base of it to stop any further bleeding. Now, the alternative treatment in a select group of patients would be endovascular coil surgery, and rather than going through the skull, this involves going through an artery with a catheter and performing somewhat of a similar procedure. Next up, let's look at a ruptured abdominal aortic aneurysm, and the first part is identifying where exactly in the abdominal aorta it is actually ruptured, whether that's going to be in the chest or lower down in the abdomen. And the reason this is important is because if the aneurysm is in the chest, you'll need a thoracotomy, which involves opening up the chest to do the surgery, or if it's in the abdomen, you'll need a laparotomy so that you can gain access to that area. Now, once the surgeon has got access to the area, they place a clamp around the aneurysm to prevent further bleeding, and that's when they get to start to work on either repairing or replacing that part of the aorta. Once the surgeon's completed the repair or replacement, they remove the clamps and make sure there's no further active bleeding before finally closing you up. Now, it's important to say that these are very high-risk surgeries, and so most patients have to go to recovery in an intensive care environment to ensure that they are monitored really closely for any post-operative complications. And some of you may be wondering, what are the recovery times for something like this? And it's really difficult to give an answer to that because it really depends on how well the patient was prior to coming into hospital. You know, if they're older and they've got other medical comorbidities, then their prognosis is poorer, whereas if you're someone that's quite young, fit and healthy otherwise, you're more likely to recover quicker. So in summary, it's really tragic here what's happened to Jo, and my thoughts go out to him and his family. Of course, you know, he'll be missed and I'm sure he won't be forgotten. I will be keeping a lookout for any details and the specifics around his death, and if there are any developments, I will be posting that on my community post. Otherwise, I hope you found the explanation of aneurysms, the description of risk factors and treatments useful. If you have any other questions, leave those down below in the comments. As always, thanks for watching, guys, and I'll see you in the next one. Thanks.
Thanks for watching. Adios amigos and chicas, of course.